And welcome. Happy New Year, everyone. I'm Mark Pinto, Adult Services Director at Phoenixville Public Library, and I'd like to welcome you to our first Zoom of 2022. A common New Year's resolution is getting more sleep, which means many people recognize the importance of getting a good night's sleep. But tonight we'll learn more about the connection between sleep and good health with Michael Montanye, who is clinical coordinator of Paoli Hospital's sleep medicine services. Michael, welcome and thanks for taking time out of your increasingly busy schedule to speak to our patrons tonight.
All right, sure. Thank you very much. Thanks for having me. Sorry for the lighting here. I have two kids back from college getting ready to return, and trying to find space in the house is sometimes a little difficult. So, but no, I think I am the clinical coordinator of sleep medicine. I've been doing practicing sleep for about 20 years. And I started out in sleep at a time where the general kind of thought process was sleep was more of a kind of a dormant state. We knew something happened during sleep. However, we weren't quite sure what. So we knew we needed it, but we didn't know the restorative powers that it had. So this little talk here is kind of a basic overview of what sleep is. I talk about, the importance of sleep, kind of basic sleep structure or architecture, as well as some barriers to getting good sleep, as well as some indications of sleep disorders. So we'll go through a lot of those things. Oops.
Oh, Michael, I forgot to ask, how do you want to handle questions? Do you want people to type into the chat during your presentation or wait till the end? What would you like?
They can do either. Type in. You're certainly welcome to interrupt me as well.
Okay.
And or just wait till the end. Any of those is fine. So this presentation takes a lot of its information from the National Sleep Foundation's presentation. There are some other things that we've added over the years when we went out to talk to groups. And one of the things that I guess I should say up front is sleep tends to be the kind of the forgotten or most ignored area of a healthy lifestyle. So we talk a lot about exercise, we talk a lot about diet, but neither of those can work without effective sleep. So we'll be talking a bit about the importance and the benefits of sleep. We'll talk a little bit about what sleep looks like, how the patterns kind of play out for all of us, what sleep deprivation does, the prevalence of this and symptoms of sleep disorders, as well as some healthy sleep tips, which strangely enough is something that we probably all know, we just don't practice. Why is sleep important? Again, it's a real important part of our a healthy lifestyle, and it's a big part of safety as well. And I don't think we think enough about that. It's essential as exercise and diet, as we had mentioned, and it's as necessary as the water we drink for proper health. This is just a quick picture of what our natural or circadian rhythm looks like. It's a little off. It's not kind of the way that I would present it, but if you can see that at the very beginning, it starts at 9 a.m. and it ends at 9 a.m. So that's a 24-hour cycle. We see, if you look at the 6 a.m., kind of on the second half of the little display there, you can see between 6 and 12, that's when we're most able to do work. So we see a rapid rise in our rhythm. And I think we all know that too. We tend to feel best mid to late morning. As we head on into noon, we have that natural mid-afternoon dip, and that's perfectly normal. We should feel a little bit slower, a little more sluggish at that point. We shouldn't feel as alert and awake as we do at 10 o'clock in the morning. But then you see the rise again right around 3 o'clock, heading into like the dinner hour. A slight kind of pause there around 9:30, 10 o'clock, and then a little kind of kick in the pants around 10 or 10:30. And then after we pass midnight, you can see that sharp decline. So, the one thing that we look for is, we kind of want to know how you're feeling at 11 and 3. If you feel good at 11 o'clock in the morning and 3 o'clock in the afternoon, you're probably getting pretty effective sleep. If you feel a little sluggish around 12:30, 1 o'clock after lunchtime, we expect that as well. So what we're looking for is, something that kind of follows this pattern. One of the things that we do discourage, and we'll talk about naps a little bit later, is, kind of doing things that will kind of circumvent this pattern. So, and maybe I better leave that till later because I'll get off track. But the idea is you shouldn't have the same level of wakefulness or alertness throughout the course of the day. I mean, that's kind of the way we look at it. So that early morning to noontime kind of elevated sense of awareness and your ability to do work. And then as we head into the afternoon, again, we see that little bit of a dip. And that's remarkably consistent from person to person. I mean, there's not really people who are night owls and people who are morning people. I mean, people do function typically better in the morning, when they say they're morning people. However, it has more to do with how we deal with it. The other thing to note too, see there at the bottom, the like 5 a.m. to 6 a.m., that kind of gully. When you wake up, you shouldn't necessarily feel like, jumping out of bed and attacking the world. I mean, there's, a good chance, that it's going to take a little bit to get going again. So if you feel a little sluggish in the morning and then you feel fine as you head into 9 and 10 o'clock, that's perfectly fine. We expect, people that sometimes have trouble, getting into things first thing in the morning. Sleep regulation, I'm not going to talk too much about this, but essentially there are other processes that occur that help keep us awake and also help us to get sleep when we need it. Our sleep cycle, you can see here there's stage 1, stage 2, stage 3, REM sleep, and wake. During the course of the night, we tend to go through 3 to 5 cycles of sleep, each lasting 90 minutes to, say, 2 hours in length. In a good sleep pattern, somebody who sleeps well, they're going to have a larger amount of deep sleep early in the night and less deep sleep as the night goes along, as you can see. And then you'll have smaller periods of REM early, and then you'll have typically your longest period of REM towards the second, later half of the night. So, when we're kids, and we tend to go through this pattern. We had regular sleep, not regular sleep cycles, but we had a regular bedtime and a regular wake time. We went through this cycle, pretty efficiently. We'd wake up, we'd remember dreams and those sorts of things. But that's because we had a regular, bedtime and wake time. Things were more normalized. As we get older, family, not family struggles, but, we do things with our family. We have work. Maybe our work schedule takes us a little out of the time that we would normally have our better sleep, or we have to get up too early, or maybe we have to get up later. Maybe we're shift workers. As we do that, we tend to fall out of these cycles. So we might go to bed later, say we go to bed at 1 o'clock. You don't necessarily, hit the cycle at the same time, basically because our rhythm's off. So we might not wake up during those REM periods, and we might not remember dreams, but suffice to say, if we're still sleeping pretty well, we're going to hit the percentages that we need. And we'll talk a little bit more about that as we go along. Typically, you want 20 to 25% deep sleep. You want, 20 to 25% REM sleep. And then we spend the rest of the time, for the most part, in stage 2 sleep. And to describe those stages real quick, stage 2 sleep is that stage of sleep where if I were to rub you on the shoulder, you go, I was almost asleep. Deep sleep or stage 3 sleep, if I saw you, that's a sleeping like a log stage, where if I were to try to wake you up, it'd be almost impossible to get you up. And then if you did get up, you'd probably be really groggy. You might say something incomprehensible, then fall back to sleep. And we see that a lot in young boys, young kids. Try to wake them up. They get off the couch and they make it about as far as the stairs, and then they might fall asleep on the stairs. That's deep sleep. REM sleep is the kind of vivid dream stage. Kind of the brain's reorganization and refreshing period. That is if I would try to wake you up in REM sleep, it might be difficult at first, but you probably startle out of sleep. But those 2 stages are really kind of critical in our overall sleep health, as well as our just health in general. This is what sleep stages look like. There's really the only thing I'll say about this is that if you're to have a sleep study and come into the sleep lab and were to monitor your EEG throughout the course of the night, the stages are unequivocal. So, when we see somebody in sleep, we know exactly what stage 2 is. We know exactly what stage 3 is. We know exactly what REM sleep looks like. Stage 1 sleep, people typically are only in stage 1 sleep for, a very short period of time. But, it's one of those things where a lot of times people will say, well, I don't feel as if I slept, but it's so consistent across all populations. There are very few exceptions. That we know exactly how long you slept, exactly when you fell asleep, exactly how many minutes you were in each stage. So, it's a very thorough and, like I said, easy to determine task. During your sleep cycle, there's a couple other things that take place. Your core body temperature decreases, and I think we all know that. If you fall asleep on the couch, watching, Monday Night Football, and then you wake up at 2 a.m. and you feel colder than you did when you fell asleep, that's what you should feel. Your body temperature is decreased. The temperature in the house hasn't decreased. Temperature in the house is still the same, but you're just chillier, because your core body temperature is colder. We see growth hormone, cortisol, and melatonin. So growth hormone helps with the initiation. Let's go to the bottom, actually. Melatonin. A lot of people are aware of melatonin because it's a supplement that's used quite often to help initiate sleep. Melatonin is released naturally in the brain as soon as the sun goes down, and we're not exposed to the blue light that is emitted from the sun. That also is emitted from our computer screens, by the way. So melatonin is released. It helps initiate sleep. When melatonin is released, it doesn't act immediately. It takes about 2.5 hours or so for it to start to kick in. Once it does, and sleep's established, growth hormone is also released. You can see that big kind of spike there right when melatonin starts to get high. That helps initiate deep sleep. Cortisol levels, you can see cortisol levels low. Cortisol is also tends to get a little higher in the evening when cortisol is working properly and we're sleeping properly. It helps with fighting viruses and things like that. So if you go to bed with a cold and you don't feel too bad, but you wake up and you feel really lousy, that's actually a good thing. That means that cortisol is doing its job and is attacking what it needs to attack. And there's a few other things that occur, but suffice to say, you can see that they're on a regular schedule. If you're sleeping properly and going to bed at the right time, these things do their job, and you'll get the kind of refreshing sleep that you need. Stress and cortisol. This is kind of interesting. One of the issues we've always had is not just sleep disorders, but it's sleep hygiene. When I talk about sleep hygiene, I mean getting to bed at a proper time, having some kind of relaxing thing that you do prior to bed. Having a cool bedroom without a lot of distractions in it, having a regular wake time, those sorts of things. When I started in sleep, and some of you may have, say, a CPAP machine or know somebody who has a CPAP machine, we started to be able to read the CPAP machines. In other words, they told us when people turned them on, when their mask was leaking, when they woke up and turned the device off. And whenever we give out questionnaires, we always ask everyone, when do you usually go to bed? What do you do prior to going to bed? How long do you typically sleep? When do you wake up? And the first thing we found out is that nobody did what they said they did. So, they might go to bed at 11 and then it's 12 and then it's 1 and then it's 10. I mean, it's kind of all over the place. But we also found out that typically people were only sleeping 5.5, 6.5 hours a night, which isn't enough sleep for the large majority of us. So from the time that we're teenagers and up, we need 7 to 9 hours of sleep. That never really changes. We tend to artificially change it because of work and family and other interests and things like that. So we get kind of enough sleep for us to function the next day, but we don't get the kind of sleep we need to function at our peak levels. So that poor sleep or lack of sleep puts a lot of stress on our body. That stress on our body can raise cortisol levels. Those cortisol levels then do the following. So you can see chronic infections and stress, say that raises our cortisol levels. Cortisol reduces the movement of glucose or blood sugar into our liver and muscle cells. Since the liver and muscle cells are not getting as much glucose as they should, our glucose insulin levels rise, and that causes insulin resistance. So in that case, once you're insulin resistant, everything you eat or most of the food you eat gets dumped into fat cells. At the same time, our muscles aren't getting enough glucose. We feel tired, we feel listless, and then that causes us to want to eat something that's going to give us a little kick. Those typically are things that we should be eating. A tasty cake and a Coke or something like that. As you can see then, once we eat that kind of feeds into the whole insulin resistant part. So we might feel better for, a very short period of time, but that food and that, still isn't getting to the muscle cells. So we're still going to feel listless and maybe worse than we felt before. So something as simple as sleep deprivation, in other words, getting 6 hours of sleep, even if that 6 hours of sleep is perfect, is still going to feed into this system. So going back to what I said about diet, so you can see that, you can have a great workout, you can, eat really well, but if you're not getting enough sleep, you fall into this cycle. And, it doesn't take long before your joints will start to hurt. Your metabolism will have to make, exceptions for, the fact that it's not getting the food that it needs to run. So metabolism slows, and, good diet, good exercise, poor sleep can lead to, waking. We need consolidated restorative sleep for, to function in safe and efficient ways, cognitive, social, and physical performance, learning and memory. And like I said, all those things kind of feed in. We'll talk a little bit about all those. Sleep needs vary over your life cycle. So you can see toddlers here in children, they have 13 to 15, 10 to 11 hours, 5 to 12 years old. Adolescents, 9.5 hours. I think anybody who's had kids knows that, these are going to vary too as children go through growth spurts and things like that. So, my son has vacillated back and forth. He grew a foot in a year once, and, he tended to it was 10 and a half hours, just because his body needed the rest. But once we get up through like 17, 18 years old, you can see the 7 to 9 hours of sleep, and that never changes. That pretty much stays the same. And you're probably thinking there are exceptions. There are some people who do well with 6 hours, and there's some people who do need 10 hours, but most of us fall into that 7 to 9 hour category. Sleep patterns, this isn't that important, but suffice to say, newborns and infants, toddlers, they tend to have more deep sleep. The wave patterns that we see are a little bit different, but the percentages still are kind of in the ballpark. As we get older, we have more medical conditions. We tend to have more periods of wake. We sometimes lose length of deep sleep. Our sleep architecture does change a little bit. I think the biggest barrier we tend to find as we age is just pain causing us to wake up, possibly other medical conditions which cause us to have difficulty falling asleep or maintaining sleep as well. Americans are not getting sufficient quality of sleep. I think that's a pretty common knowledge, and this probably is incorrect. It says 39% of Americans are not getting 7 to 9 hours. I would venture to say that's probably, especially on the East Coast, in between Boston and Washington, D.C., and about 30 miles west, we're probably closer to 60%. I know very few people who are on a regular basis getting the required 7 to 9 hours of sleep. And then 74% experience sleep problems that affect the quality of their sleep. This is something that's interesting too, that goes along with the length of sleep. This is a little hard to read, but you think of blue as being good and red as being bad. So they took a couple of groups of people, and they had 2 days of sleep. 10 hours of sleep time doesn't mean they slept for 10 hours. That just means they were provided 10 hours of sleep time. The other group was for after 2 days, they were provided 4 hours of sleep time. Leptin and ghrelin are those, I'm not going to get into too much detail, but basically your brain tells you you're hungry, and your stomach says you're hungry. And then also if you're satisfied. So they were given the same exact diet, same number of calories, same people. After 2 days, you can see leptin levels are high and ghrelin levels are low. What that would indicate is that you feel like you don't feel hungry, and your stomach is satisfied. Same group of people, only 4 hours of sleep time, same diet. They felt like they should eat, and their stomach said they were hungry. Again, same caloric intake, same diet. And over to the right, after 2 days of 4 hours bedtime and 2 days of 10 hours of bedtime, you can see how they flip. So sleep or lack of sleep will cause your brain to basically say, hey, after you get past a certain point, even if you've had enough food to feel satisfied, your brain will flip it and actually cause you to feel as if you should eat, and your stomach will feel hungry as well. Excessive daytime sleepiness, we know there's a lot of consequences, the least of which is driving to and from work. We have a whole other presentation on the types of accidents that have been caused. Almost every major accident seems to have been caused by sleep deprivation. Memory is impaired when sleep is not consolidated. Paying attention to and completing tasks is compromised. We all know, and we've felt this before, where our mood is impaired. The less sleep we have, the shorter our fuse tends to be, the more quickly we'll snap, or quickly we become frustrated with things and have difficulty performing tasks. There was a study done. It was kind of interesting. It was a study on people who were gambling, and they sleep people who were sleep deprived. And what they wanted them to do was make kind of gambling decisions. I believe it was cards, but essentially what the study showed was that people who are sleep deprived make bad decisions. And the fun part of the study was they gave them, something to help, whether it was coffee or whether it was like 5-hour energy or something to kind of give them a little bit of a boost. What they found is that they did make decisions more quickly, but they still made the same bad decision. So they just made a bad decision fast, rather than, helping them with that decision. We know memory is impaired. And that, I think, again, we've all probably experienced that the more sleep deprived you are, the harder it is to do something like, put a simple sentence together. It's harder to pull information out. That's one of the reasons why when, we talk about best study practices when kids are taking tests, studying the day before, like you shouldn't study the day before a test. You certainly shouldn't cram the day before a test, but getting a good night's sleep before a test is by far the most effective way to take a test. This is something that, I'm not going to spend too much time on, but we know how many accidents are caused by sleep deprivation, nodding off at the wheel. And coffee and those sorts of things doesn't help as much as you might think. So, whether it's shipping accidents or 3 Mile Island or the Exxon Valdez, I mean, there's the list is kind of endless as to almost every train wreck seems to have something to do with sleep deprivation or falling asleep at the wheel. Body systems associated with major diseases such as diabetes. And we can see simply from the cortisol example that we used, how that can affect diabetes, stroke and hypertension. Stroke is a big one right now. Up to 84% of people who have had a stroke either have obstructive or central sleep apnea. Hypertension, congestive heart failure, and other functions less effectively. Even skin issues can be caused by sleep deprivation. One of the things with stroke and hypertension, congestive heart failure, all of those, is your cells. The time that your cells are able to recuperate, get rid of most of the waste that's in them, get that out into the bloodstream to rid itself of that waste, doesn't happen. So the less sleep you have, the more plaque that builds up and travels around, your circulatory system. The more that happens, the more susceptible you are to stroke and hypertension, congestive heart failure. And I usually do this thing on a board that kind of shows how the cell, kind of cleanses itself during the course of a night. It's, the one thing about it is, look at it this way. If you need 8 hours of sleep and you get 6 hours of sleep, you'll probably feel okay. But then after 2 nights of 6 hours of sleep, 3 nights, 4 nights, after 7 nights of just getting 6 hours of sleep and you needed 8, that is 14 hours that you've missed during the course of a single week, which is essentially 2 full nights of sleep you're missing by getting 6 hours of sleep. In the course of a week, that takes a real toll physically. But if you stretch that out over a 30-year period, you can see kind of the consequences that the body would suffer over time. The very least of which would be the fact that your heart has to work 2 hours longer than it should, at more optimal levels, than it would if you had gotten those 2 extra hours of sleep. Common circadian disruptions. So we talked about the circadian rhythm at the end. We're familiar with jet lag. and shift work. Before I head into these, does anybody have any questions about kind of the basic kind of architecture of sleep?
There is one question, Michael, that's been in the chat.
Okay. Oh, I don't see the chat. Oh, there it is. Okay. Yeah, that's actually perfect for this slide. So 7-7, yeah, that, and I used to be a 7 to 7er, 7P to 7A. Third shift worker. Yes. So here's the thing about shift work. Our circadian rhythm is governed by the light-dark cycle. So the sun comes up, it turns us on, essentially. The sun goes down, it turns us off. People who work shift work, it kind of depends on how you handle that. So there's always going to be, a detriment to working shift work. And the reason is it's very difficult to not expose your brain to light, because you got to drive to work, you got to drive home. So depending on the time of year, that can be very difficult. So there are different things that you can do to kind of help with that process. One is, and probably the most common one for people who are, shift, I guess depends. If you're always doing, say, 7 to 7, and that has always been your shift, and you've done that for years and years, staying on shift is probably the healthiest thing to do, although it's probably not practical, especially if you have a family. The next thing that you would do would be if you work 3/12s. And the way I used to do it would be I would work Sunday, Monday, Tuesday. And then Tuesday, Wednesday morning when I got home, I would stay up and I wouldn't go to sleep until the sun went down. And then when the sun went down, I'd go to bed. Now I wouldn't do anything that was, put myself or, other people in danger. But I would just do, basic tasks around the house. And then I would go to bed, around 7 o'clock or when it started to get dark, and then, wake up again in the morning. I also might drink coffee on the way home and sleep for about an hour and a half, and then wake up for the rest of the day and then go back to bed at 12. So, but unfortunately, your rhythm does not, change to your work schedule. And a couple ways you've probably felt that is just kind of the way your stomach feels, like how hungry you are at night. I mean, it's just a different feeling altogether. And that's the whole cortisol process. It's, the body temperature declining part. Those things don't seem to change regardless of how, detailed you are, with your schedule. So it does put a lot of stress on the body over time, and can have some of the same types of effects as sleep deprivation. You've probably also found, if you've done 7 to 7, you probably also found it's really difficult to sleep 8 hours during the day. Your body just won't allow it because your temperature doesn't decrease. So it's very difficult. So, if you want to, I can address that a little more thoroughly towards the end, but the circadian rhythm, in this part of the country, in Northern Hemisphere, in Pennsylvania, is going to be the same for somebody who works shift work as it is for somebody who doesn't. You can shift it one way or the other a little bit, but it still pretty much stays the same as long as the sun comes up and as long as the sun goes down. You're just going to have to fight that. And like I said, we do have some tips on that. So the circadian disruptors, shift work, jet lag. But what I will say is by far the biggest problem we see is people just staying up too late. Like the worst thing that ever happened was the 11 o'clock news and having the weather and sports at the end. Because and then dipping into my generation, the Johnny Carson show. The problem is that people would stay awake to see those things, and that forced they're exposed to TV, they're exposed to the blue light that we talked about, and they have difficulty getting to sleep. I mean, you might eventually pass out, because you've been awake too long, but you still have to get up to go to work. That's a circadian rhythm disorder. It's called delayed sleep phase. So you lose the ability to go to bed at a reasonable time, but you still have to get up. And, we see that a lot, in all generations. We see it a lot now with kids, especially because they're up, all hours of the night, on their phones and computers and things like that. So it's a tough one to deal with, actually. Recognizing sleep problems. Excuse me. Snoring loudly, that's more of a problem for everybody else than it is a problem for the person who's snoring. But that could be an indication that there's enough of an obstruction that, that person might have sleep apnea. Feeling sleepy or dozing off while watching TV, reading, driving, I wouldn't say that so much, but driving and engaging in daily activities, that would be the thing that would, concern me. Being tired at 11 o'clock in the morning and 3 o'clock in the afternoon, those are things we look for. Feeling as if you have to take a nap at 1 o'clock or 1:30 and not being able to stay awake. Those would be indications. Waking up with headaches, things like that. Weight gain. Weight gain is actually an indication of poor sleep as well. Feeling unpleasant, tingling, creepy feelings, or nervousness in your legs when trying to sleep. That's restless legs. Interruptions to your sleep, nighttime heartburn, bad dreams, pain, discomfort. We see more insomnia probably than any other sleep disorder. So most people are familiar with obviously sleep apnea, and we see a lot of that as well. But sleep doctors probably deal more with insomnia issues than most any other issue. Oh, and insomnia. So insomnia is difficulty falling asleep, and most people attribute, when they think of insomnia, they think of not being able to fall asleep. But much more common than that is falling asleep and then waking up 2 hours later and not being able to get back to sleep. We see that much more often, and that's oftentimes a bigger issue, because you wake up, you've had enough sleep where you have a little kind of kick in the pants, and then your mind starts racing and you're thinking about things that are going on in your life. We see that much more in women than men, but that is a big problem. Unrefreshed or non-restorative sleep. So those are the people who go to sleep, felt as if they didn't really wake up, but when they do wake up, they don't feel as if they've slept well. Prevalence of insomnia. About 40% of Americans experience occasional insomnia, 10 to 15% on a chronic basis. Most at risk, as you can see, we mentioned that before, women, older adults, depressed persons. Causes and types. And I won't spend much time on this, but you see the chronic, that's greater than a month or at least 3 nights a week. Acute, they are, a few nights each week, sometimes, 1 to 2 weeks. And that could be because of issues going on at work or issues going on at home. But we don't see too many patients with that, because our experience is people don't come in until it's kind of it has become a real issue. So we see more chronic and primary insomnia than something like an acute insomnia patient. Treatment, there is pharmacological treatment. So there's over-the-counter medications and prescription medications, but most sleep doctors are going to use medication to get people back onto a cycle. By far, the most effective treatment is behavioral management. Sleep restriction, cognitive behavioral therapy, which is a whole big part of sleep medicine at this point, relaxation training. When we talk about behavioral management too, we talk a lot about sleep hygiene and kind of the basics of how to get good, effective sleep. And I'll talk a lot about that, or a little bit about that towards the end. Sleep apnea, this is one that most people are very aware of now. Sleep apnea is just a soft palate collapsing on the back of the airway when you're sleeping. Just like the rest of your body, your tongue and that soft palate relax when you're sleeping, and the deeper sleep you get into, the more it relaxes. So it falls on the back of the airway, and then air just can't get in and out. So what you'll see is, on our studies is you'll see, the respiratory pattern kind of decrease, flattens out because the air is not getting in and out, but you'll still see the patient trying to breathe. And then the brain says, we need more oxygen, has a big gasp, and then that process starts all over again. As you can imagine, oxygen levels decrease because your heart is now circulating old air. And the two things happen. One is you have an oxygen debt. And at the same time, it'd be the equivalent of somebody every time you're about to fall asleep going over and kind of rubbing you on the shoulder to wake you up. So those constant interruptions prevent the person from getting into deep sleep and getting into REM sleep and having a kind of a restorative sleep process. Treatment is, avoid alcohol, nicotine, sleep medications, those sorts of things. That's true, and they do cause issues, but not the kind of issues, I guess, that is most important, primarily the airway collapsing. CPAP is still the most effective treatment by far, actually. However, it's not tolerated by everyone. So there are other treatments. There's dental appliances. There are now surgical procedures with implants that help activate the muscles necessary to keep the airway open. That is also has proven to be more and more effective, and more people are looking to that as an answer. There's even medications in the works right now, which are being trialed and tested to see if they're going to be effective. The biggest difference between some of those treatments are CPAP, if used and used well, eliminates apnea altogether, where the other types of treatments either just reduce the incidence of apnea or are more reactive and not proactive like CPAP would be. Restless legs, we talked a little bit about that. Restless legs is when your legs, like when the sun goes down, you start getting that kind of creepy feeling in your legs. Very similar if you haven't had it, if you remember what growing pains were like, or maybe you worked out real hard and you have that kind of feeling like you kind of can't sit still. That would be what restless legs feel like. But what ends up happening is it prevents you from going to sleep because you're in such discomfort. And, to the extreme, we've seen people who were, they have to get out of bed. They're squats. They're very restless when they try to sleep. It's very, it's one of the more difficult sleep disorders actually to treat. Narcolepsy, excuse me, is a neurological issue. Essentially, the brain never turns off. So, those individuals aren't getting the kind of relaxing sleep that the rest of us get. One of the interesting differences is when we're tired and we nod off, typically we'll catch that. We might fall asleep, but we don't get into deep sleeps quickly, where people who have narcolepsy oftentimes will fall into REM sleep almost within minutes. So it's not just that they're tired; they're extremely tired most of the time now. And this is one of the only sleep disorders that really has to be treated with medication to get some relief for the patients. Napping. This is always a big question we have. Are naps helpful? How long should they be? What time of day should they be? They can be very helpful. The time of day they should be would be like early afternoon. The later in the day they get, the more they're going to affect your overnight sleep. And like we stated before, we want sleep to be consolidated. The length of naps, about 30 minutes, 20 to 30 minutes is about as long as we would go. Anything longer than that, you risk, getting into deeper sleeps, and you also risk, waking up not feeling quite right because you did get into deep sleep. But more importantly, we want them to be enough to be restorative, but not enough that they're going to affect the overnight sleep. Sleep problems disorders. The symptoms and experiences of sleep problems should be discussed with your doctor first. A lot of times, we do recommend people going to a primary care physician first before they would see a sleep doctor. And one of the reasons for that is that there's, if you're taking medication, there could be a reason for your, daytime sleepiness that's related to the medication, not related to any sleep issue that you may have. And some other reasons, obviously, but typically people will start with their primary care physician, then they'll be referred to a sleep doctor. We see a lot of patients now who are being referred to, though, by cardiologists, ENTs, other specialties, because of the relationship with, diabetes, with, heart issues as well. Snoring, sleep apnea, restless leg syndrome, and narcolepsy are all treatable disorders. So when we talk about diagnosis and treatment, there are some things that are diagnosed by sleep study only. But I would say a majority of patients who see a sleep doctor, not a majority, but a large number, don't ever come into a laboratory. I mean, things can be treated without having a polysomnography or an overnight sleep study. We now have daytime sleep studies that test for sleep apnea that you can do at home and don't have to come into a lab for. But most of the diagnosis for, say, sleep apnea, parasomnias, those sorts of things are done in the laboratory with an in-lab test. Treatment, we talked about behavioral therapy, medications. Medications, like I said, we don't deal a lot with medications in sleep, but it is something that we do use. Devices or appliances, and then there are some surgical procedures that can be used. One of the things that I wanted to talk about, maybe the most important part of what I'm going to say today, are the things that you can do to get effective sleep.
Mike, before you get to that, there is another question in the chat.
Oh, there it is. What about sleepwalking? Is it treated pharmacologically? The first one, Annie's question, sleepwalking is interesting because it occurs, there's sleepwalking, which occurs during deep sleep. And that's the, you see that a lot of times in like young boys under the age of 12, but it can continue into adulthood, where you might get up and do things that you would normally do, like, walk downstairs, go to the refrigerator and get something. But it typically is a normal act, something that you typically would do. Usually it can be treated with medication if there's some kind of underlying issue. In other words, and let me step back a little bit. Sleep deprivation oftentimes is responsible for that. And if there's something they can do to help with that, get you on a regular schedule and, have the proper amount of sleep, then yes, sometimes that can help. But my guess is that they probably wouldn't treat it pharmacologically. Now, there are people who have like REM behavior disorder. Now, that's a little different than sleepwalking. That's actually acting out the dream itself, and can be harmful. And that probably, again, is not treated with medication or behavioral therapy. And my guess is that in most cases, sleepwalking would be treated more behaviorally. And I guess that also depends too on the age of the person. Are they like a younger child, a young girl or boy under the age of 12, or is it somebody who's 35 years old and doing that? We also see sleepwalking sometimes occurring in people who are taking sleep medications already. They can lead to that. So yes, it can be treated pharmacologically, but in most cases, it's probably going to be more of a behavioral treatment. And sometimes I'm so tired when I go to bed, I can't sleep, but feel wakeful. Yes. So when you go, in other words, I guess the question is you're super tired, you want to go to bed, but when you get to bed, you can't sleep at all. That does fall into the category of insomnia. Some of the things that are helpful in something like that, which a doctor is probably going to ask you to do, is, again, that falls under the category of cognitive behavioral therapy, and keeping like a journal, a sleep journal, where you track everything from wake time, bedtime, when you eat, how long you sleep, how you felt like that sleep was, those sorts of things. One thing that can help now, interestingly enough, is like on your watches, whether it's a Fitbit or an Apple Watch, they have that. They try to tell you how you're sleeping. They don't really tell you how you're sleeping. It's what's called actigraphy, and it's basically monitoring body movement. And what's really helpful about that, not so much whether it's letting you know that you got this much deep sleep and this much REM sleep, but it gives you a pattern. And what we like to see is bedtime, wake time at about the same time all the time. The more it kind of oscillates, to 10, 11, 2 o'clock in the morning, and then back again, the more trouble people are going to have with, their actual sleep schedules and actually feeling tired when they go to bed. So maybe combining a sleep log along with, kind of tracking that activity on a smart watch or something like that would be helpful. But that's usually where they would start when it comes to, feeling tired but not being able to fall asleep. And then if there are other issues underlying that, like, racing thoughts and anxiety, then that's where the cognitive behavioral therapy would probably most likely come in. So getting to the tips, and this actually might kind of falls in line with both of those questions. You want to establish a regular bedtime routine. And believe it or not, the most important thing you can do is have a regular wake time. The wake time is more important than the actual bedtime, because that kind of sets the bedtime. So say 6 o'clock is the time you choose, or 7 o'clock is the time you choose. One of the bigger problems we have is, people going to bed at like a normal time, but then when it gets to Friday and Saturday, they might go to bed at 10 all week, and then Friday and Saturday they go to bed at 2. But then they wake up at like 11 in the morning. So they go to bed late, they wake up late, and that just kind of pushes your schedule ahead. So you kind of get off of your natural schedule. And that's, one of the leading causes of contributing to delayed sleep days and those sorts of things. So what we suggest is if you go to bed late, we still kind of want to wait you to wake up at the same time you would normally wake up. So maybe not 7, but maybe 8, because we would much rather you be tired, around 7 or 8 o'clock the next day, and go to bed closer to your normal bedtime, than kind of push that natural cycle forward so that you're going to bed at 2 and then you sleep till 11. Now you really don't feel like going back to bed again until a later hour. So having that regular wake time really does kind of set your clock the proper way. Plus it exposes you to light, at the appropriate time as well. You want to engage in a relaxing, non-alerting activity. So you really want to stay away from TV, laptops, smartphones, those sorts of things, about an hour or so before bed. Don't drink or eat too much prior to going to bed. Maintain a quiet, dark, preferably cool, but comfortable sleep environment. We do recommend making sure you don't have televisions in your bedroom. We would even prefer that you read outside of your bedroom. And then when you're ready to go to bed, then to go, into your bedroom and use your bedroom really only for sleeping. So there are some other things that, some of those things that, like my grandmother would always say, like drinking warm milk or, taking a hot bath. Those sorts of things are actually all valuable and would all be helpful. So a lot of the things that we had always done, up until maybe, the 80s, were beneficial. And I think if you've ever gone on a vacation where you didn't have those sorts of distractions, where you didn't have, TV, or other things to do, I always hear people tell me how relaxing those vacations were, and how they had difficulty staying up. They played board games and felt refreshed when they came home. Well, that is mainly because they allow their body to kind of settle back into its normal rhythm. And it doesn't take long for that to occur if you start taking those sorts of things away. TV and all the distractions we have really played a big role in, like over entertaining us. I still don't know, and I do it all the time, don't know the reason for clicking through all the channels when I know I'm not going to find anything I want to watch. And those are all detrimental to our regular sleep cycle. Getting rid of those things to a certain extent can play a big role in getting us kind of back onto a kind of a healthy sleep cycle. And once we're on those healthy sleep cycles, and our body is able to, restore, get rid of the waste that we built up during the day. The cells are refreshed. The plaque and all the waste has been moved out of our system, and our bodies, naturally, basically overcompensate. We're able to do more work in that case. So we're able to exercise, and our diets actually are much more effective. But more importantly, our quality of life just increases because we now feel like doing the things that we would want to do. Are there any studies on minimizing nightmare frequency if those are causing issues with sleep? There are. I can't speak to them specifically. Weighted blankets. I did see that one up there too. I'll get to that one next. The studies themselves, again, have the interesting thing about nightmare frequency is it's not necessarily a bad thing. in this respect is if people are having nightmares and they're having them often, it does let us know that you're getting into REM sleep frequently, which is a good thing, because that is a very important part of the sleep process, and helping to restore and refresh the brain. So that's a good thing. However, typically it can have to do again with sleep schedules. It can have to do with sleep deprivation or getting the proper amount of sleep. But again, that tends to fall into the category of cognitive behavioral therapy. And so one of the first things they probably do would be to find out how much you're sleeping, when you're sleeping, like when you're going to bed. Are you on schedule? Does it occur when you have a good night's sleep after a poor night's sleep? That sort of thing. Is there a trigger for it? And that's what they're going to look for first, and then they may suggest changes in say sleep schedules to help with that. And I also want to differentiate nightmare with night terrors. So night terrors are something a little bit different. Night terrors actually occur during, in the drop into deep sleep. So that's not quite the same thing, but that does have a lot to do with sleep deprivation. But yeah, so yeah, that'd be something that would be like discussed with the doctor. That probably wouldn't require a sleep study, although they might want to see if there's some other kind of parasomnia going on, like REM behavior disorder. And I hope that helps. What are your thoughts on weighted blankets? I think weighted blankets, I've heard they're very helpful. You just have to be careful that they're not create more heat, because you do want your body to be able to get cool. So, but the weighted blankets, I have heard that they're very helpful. I don't have a lot of experience with that. That's not something that we deal with a whole lot. But I have heard good things about it. So that is pretty much it on the kind of the basics of sleep. Any other questions? Any thoughts?
There's another one in the chat there, Mike.
Oh, sleep meditations, sleep stories, and/or music to help. Oh, yes, that actually is falls into the category of a kind of relaxing bedtime routine. We have a lot of people who use I don't want to call it noise machines, but that's what they are. Music, sleep stories. Yeah, that I think those things are very helpful. And they do kind of create that kind of relaxing, not just relaxing bedtime routine, but a comfortable kind of bed environment, which would be very helpful. I think that's something we don't do enough anymore. I think, when I was a kid, very few people had a TV in your room, but you had a radio. One of the things I used to do is I would always fall asleep back when the Phillies were on KYW News Radio 1060, and I would listen to the Phillies game until I fell asleep, and then I would wake up, because I would never make it to the end. Wake up and have to listen to the score on the news, or the sports. But listening to music prior to going to bed, I think all those are very helpful. I will say this, just in kind of closing. The one thing about, like I said, that we don't think about as much as we should is our bodies. And like I said, usually when I have a board, I kind of draw, and since I don't have anything to write on right now, I kind of skipped over some things that I would do to kind of make things a little more understandable. During the day, we're upright, so our heart is working against gravity to get blood and everything from our feet to our head and back down again. We're constantly moving. Our brains are just typically constantly active. So even if we're not, doing physical labor, our bodies are still doing a lot of work. Our bodies produce more waste than they get rid of during the course of the day. So I look at it like Lincoln Financial Field during the Eagles game. The buildup of waste, in the stadium is pretty dramatic, and it's very difficult to clean it while the people are still there. When you lay down, now you're kind of you're not kind of horizontal. You are horizontal. Your blood is now heart is now pumping blood side to side, so it's not fighting gravity quite the same. But more importantly, there's really not a lot of activity going on. So your body has the opportunity to get rid of the waste that needs to get rid of. Well, we shorten that sleep period. So if we're depriving ourselves of sleep by not sleeping long enough and getting 6 hours, it's not like exercise. Like, we lift more weight, and then, so you can, lift more weight. And you get better at it. Your body doesn't get better at the repair work. So you can't shorten that down to 6 hours just because you're a good sleeper. It still takes 8 hours. So if you only get 6 hours of effective sleep, you're 2 hours short. And so there's a lot of work that's not done that has to get done. That's really critical over a period of time. And I think in today's society, when we're looking for kind of instant gratification or things that we can take to maybe a workout that's going to work faster, a diet that's going to make us lose weight quicker, we kind of lose sight of the fact that when it comes to sleep and health and those sorts of things, sometimes it's going to take a little bit of time, but it's worth the effort to do those small things that it takes to get us kind of back on track. And once we are sleeping well, and once we are sleeping effectively, you'd be surprised at how quickly, and how much you're actually able to do, because of that. And we do see that quite a bit. Now, our examples are kind of extreme, because of, people have severe sleep apnea and then are treated, and then suddenly they're like, oh, I can't believe, how poorly I felt. But in most cases, it's not like that. In most cases, it is, kind of a 6-month process where after the end of 6 months, you're doing something. Wow, I haven't felt this good in quite a while. It typically is not an overnight change. Very similar to exercise or diet. I mean, it's something that's going to take time. It takes a little bit of work, but it's certainly well worth it. Any other questions?
Thank you so much, Mike. Yeah, anyone else for Mike? Feel free to unmute or type in the chat. Really appreciate your sharing your expertise tonight and advice.
Sure.
Great. Yeah.
I haven't done too many of the, we used to be out maybe, 2 or 3 times a month in person doing these talks. And I tend to move around a lot, and having a board or something to write on always, kind of sends me off in a different direction. And
I have an idea for you about that, which I'll email you about later.
Okay.
Anyone else? If not, we'll call it a night. You can all go to bed. Mike, thanks again.
All right. Thank you. Thanks, everyone.
Thank you.
Everybody for tuning in. Good night now.
Thank you.